Hello everyone, welcome back to my channel. I'm Dr. Swarada Ambardekar, General Surgeon and Proctologist. Today we are going to discuss about Sitz bath in detail. So let's start with what is Sitz bath. Sitz bath is basically a jacuzzi or bathtub in which you immerse your perianal region, that is the area around your anal region. We use warm water for this therapy. You must have watched my previous video, which is short video on Sitz bath stating advantages and limitations of Sitz bath.
Just for your reference, these are the advantages and limitations.
I'm not going to repeat those topics here. We are going to proceed for next topic. I'll start with directly diagnosis first. So if you are diagnosed with perianal fissure, abscess, fistula, or even piles which are not in yet bleeding stage, you can use Sitz bath as home remedy. Any kind of undiagnosed condition in which you are having cutting or sharp pain at your anal canal, you can use Sitz bath as temporary relief. If you have underwent any anorectal surgery, which is for piles, fissure or fistula or any other condition, you should take Sitz bath only after consulting with your surgeon. Now we will proceed for the next topic, which is when to avoid Sitz bath. Firstly, in any kind of active anorectal bleeding, you should avoid Sitz bath as it may increase the bleeding. Secondly, in case of uncontrolled diabetes, the patient should avoid taking Sitz bath. If you notice any kind of pus discharge or white discharge from your anal region, you should stop taking Sitz bath as it may worsen the situation. And lastly, if you have any kind of skin infection, itching at your anal region, you should avoid taking Sitz bath. Now let's discuss how to take Sitz bath properly or what is the right method to take Sitz bath. To start with, first use the clean tub. Do not take any previously used or contaminated tub for Sitz bath. Secondly, fill the tub with warm water, which is not hot and not too cold for Sitz bath. Ideally, 40 to 45 degrees Celsius of the temperature is recommended for Sitz bath. Third step is to add solvents. If your doctor or surgeon has prescribed any specific solvents, then only you should add solvents to the tub bath. Lastly, sit in that tub and try to relax your perianal region as much as possible. You can combine Sitz bath with Kegel's exercise. Just 10 to 15 minutes of this Sitz bath will give you pain relief. Once you are done, clean the area and dry it nicely. Sometimes we prescribe you few medicines to add to this warm water. Let's see what we recommend as per the condition. First one is salt. We prescribe Himalayan or rock salt to add to the warm water if you have any kind of inflammation or swelling at your anal region. Second one is betadine solution. We usually recommend 5% concentrated betadine solution for Sitz bath. It is antiseptic solution. We usually advise betadine solution after surgery to prevent any kind of infection to the surgical site. Third one is potassium permanganate, or we call it as KMNO4 salts. We recommend it in conditions like excessive pus discharge or foul smell at your anal canal. But if you don't know about your condition and you haven't taken any expert advice before taking Sitz bath, I recommend you to take plain warm water Sitz bath for your conditions. Please do not self-medicate. If it is not the right treatment for you, it is going to worsen the situation. So now to conclude this video, I would say Sitz bath is a supportive treatment. It is not the final cure to your anorectal condition. If you are suffering from any anorectal condition and you need expert opinion, you can book the appointment on the given number. Consult us to know more about your condition and get recommendations as per your condition. Thank you for watching this video. Please like, share and subscribe.